Hey everyone, welcome to our presentation on Down syndrome. We are Ziva, Reut, Odaya, and Jenny, and today we'll talk about this genetic and neurodevelopmental disorder. Our goal is to provide an overview of the condition, its causes, characteristics, and what behavior analysts should consider when working with individuals who have Down syndrome.
Down syndrome is a genetic disorder caused by an extra copy of chromosome 21, which is why it's also called trisomy 21. It's classified both as a genetic and neurodevelopmental disorder because it affects the brain and development. The condition was first described in 1866 by Dr. John Langdon Down. Today, it's known as the most common chromosomal disorder worldwide.
The main cause of Down syndrome is an error in cell division that results in an extra chromosome 21. This can happen in three ways: non-disjunction, which is the most common, translocation, and mosaicism. Diagnosis can happen during pregnancy using tests like non-invasive prenatal testing or amniocentesis. After birth, doctors usually notice physical features and confirm the diagnosis through genetics testings.
Down syndrome occurs in about 1 out of every 700 births. Although the chance increases with the mother's age, most babies with Down syndrome are actually born to younger mothers. The conditions affect people of all races and regions equally. There is no difference in how often it happens based on ethnicity or geography.
People with Down syndrome often have distinct physical traits like almond-shaped eyes, a flat face, a short neck, and low muscle tone. Cognitively, they usually have mild or moderate intellectual disability and may face challenges with language, memory, and problem solving. In terms of behavior, many individuals are very friendly and social, but they can also show signs of stubbornness or attention difficulties.
When working with individuals with Down syndrome, behavior analysts may face some specific challenges. These include language delays, difficulty with transition, and short attention spans. Effective intervention may include functional behavior assessment to identify the function of the challenging behavior, transition warning and timers, giving advance notice before change to reduce resistance, use of visual support, visual cues, schedule to promote predictability and reduce anxiety, teaching adaptive life skills like toileting, self-help, and communication, often with support using physical, verbal, or visual prompts and gradually reducing them to build independence using task analysis and training, using positive reinforcement in promoting engagement and adapting behavior, differential reinforcement, reinforcing appropriate behavior while minimizing reinforcement for problem behaviors.
Let's look at a case example. In this case, we meet Noam, a 6-year-old boy with Down syndrome attending kindergarten. Noam often struggled with transitions between play and structured activities, expressing resistance by crying, sitting down, or refusing to move. To address these challenges, a behavior analyst introduced visual schedules and provided consistent 5-minute advanced warning using verbal prompts and a visual timer. Clear, direct instructions with eye contact further improved Noam's compliance, making transitions smoother and reduce stress. These examples shows how individualized support and reinforcement can make a big difference. Let's take a look at a short video that summarizes what we just said and saw.
Hello, my name is Chloe and I am 8 years old. I would like to tell you all about Down syndrome. Down syndrome is something that some people are born with. Nobody knows what causes it. It just means we have a little extra something. Our body is made of lots of tiny cells. These cells are smaller than a tiny, tiny dot. So tiny we can't even see them without a microscope. Each cell has something called chromosomes, which contain information that decides how you look. From your eye color, your hair, and even how tall you will be. Babies are born with 46 chromosomes, 23 from mum and 23 from dad. Some lucky babies have been gifted an extra chromosome. Yeah! When this happens, it's called Down syndrome. Just like the color of your eyes, you can't change it. If no one else can catch it, it's just a small part of the wonderful things that make you unique. Only one baby out of 1,000 are born with Down syndrome in the whole wide world. I am one of those lucky babies. Apart from my extra chromosome, I am just like you. I go to school. I love to dance. I love to sing and play and have fun with my friends. I like spending time with my family, and I love to eat chocolate cake. Yum! Sometimes people who have Down syndrome can have other health conditions, or may have difficulty hearing, or even use Makaton signs to support them speaking. And sometimes they can take a little bit longer to learn things, or may need a little more support. It just means you need to be a wee bit more patient and ask if I would like some help. Sometimes I may want help. Sometimes I really want to learn how to do it myself. Children sometimes want to play, but are worried to ask me. But guess what? I love to play and have fun. Just face me the same way you would anyone else. And we could be the bestest of friends. We could dance, sing, play, and even eat chocolate cake together.
Here are some of the sources we used for our presentation. These sources provided valuable insights into behavior interventions and characteristics associated with Down syndrome. Thanks for watching.